As a doctor, I know you come across patients or family members who say, Doctor, I stay indoors. I don't even go out, so I'm safe. So let's bust this myth.
Pollution starts to affect our lungs, not just the lungs, the whole body. Children who are reaching 15 years of age, 16 years of age, still not having achieved their peak lung growth. And what is responsible for that? Definitely pollution.
Hello, everyone. Welcome to the show. Today, we are diving into something that quite literally runs beneath our nose every single moment, every single day. Yes, you're right, the air we breathe. And if you're living in a city like ours, at times it feels that we are chewing the air rather than breathing it. So today we had to get in someone who knows lungs better than most of us know our morning coffee routine. Joining me today is Dr. Arjun Khanna, our revered pulmonologist.
Hi,
Welcome,
ma'am.
Arjun, to
Thanks,
the
ma'am.
show.
Thanks for having me here. Thank you.
Okay. So before beginning, I have a confession. A few days back, I woke up with a scratchy throat, heavy, head, and a weird tightness of the throat, chest. And I actually thought, could it be viral? And then I saw the air quality index, and it was scarlet red. So my question to you is, what? How early does pollution affect our lives, and are we really noticing it?
Ma'am, I have a confession to make. I wake up with that every day.
Oh.
So
Oh.
it's the same story, and I think it's been on repeat mode for the last many years now.
Mm-hmm.
And probably we've not done enough. Pollution starts to affect our lungs, not just the lungs, the whole body. And it's been doing so for many years now. And you don't have to wait for it to get scarlet red for it to show its effects. The effects have been there for a very long time now, and they're getting amplified. And the way it is progressing now, a couple of days back, the AQI was more than 900 in Faridabad. The time is not near when probably the place would become uninhabitable. It is almost there,
Mm-hmm.
but probably we'll have to pack our bags and leave the way it is progressing. So it does affect the lungs, it affects the whole body in a really bad way, and you don't have to wait for it to become really scarlet red for it to cause bad effects. The levels at which life is sustainable would be somewhere around 50, maximum 100.
Yeah.
We are living in a gas chamber, literally.
Yeah. So basically, it's like, when our body is starting to whisper things, we actually need to act and not when it is screaming back to us.
Exactly.
Right. So as a pediatrician, most of the parents they are concerned that are the children really vulnerable or are we worrying too much about the children? So what is your say on this?
I think we are worrying too less. We need to worry more. We need to be more proactive about it. And we need to ask questions to the authorities as to what the authorities are doing. You and me at our level, what can we do? We can warn people.
Yeah.
We can take precautions for ourselves, but we cannot, do something really radical for the community. So the parents, when they ask us these questions, whether they're doing enough and whether they should be worried for their ward's future lung health or general health, I think their questions are valid, and they really need to start asking questions now.
So it is, children are growing in a hostile territory with the air around.
Absolutely, so there is data to show. We collected a little data, and we were doing these, random lung function tests for children. So from Delhi NCR, it has been seen that the lung function of children who are to the tune of 15 years, 16 years of age, their lung function is what 10-year-old children or 8-year-old children would have. So peak lung growth occurs during 8 to 12 years of age. So this is unfortunate, children who are reaching 15 years of age, 16 years of age, still not having achieved their peak lung growth.
Yeah.
And what is responsible for that? Definitely pollution. So it is affecting these children in a big way.
So you've talked about this lung function. So, is there any single or any test that we can say that your lungs have been affected for a long period of time because of the polluted air?
Unfortunately, no. None of the tests such as X-ray or a CT chest would tell you that. The lung function tests, the conventional lung function tests that we have, the spirometry, the PFT, the body box, are going to be affected only when you have significant lung disease. And for air pollution, you really, you should not be waiting for that level when your PFTs become abnormal due to pollution. That would be too little too late. So unfortunately, there is no test which is going to tell you that your lungs have been affected by pollution. The standard lung function tests would be, affected if someone has a very heavy exposure to the pollution. And when the pollution has already caused a disease, when it has led to COPD, when it has led to bronchitis, then yes, your PFTs, your spirometries would show us dysfunction. But that's not what you should be waiting for.
That's exactly what we should be doing. I mean, kind of moving on with our tests regularly as and when the doctor tells. And then, as a doctor, I know you come across patients or family members who say, Doctor, I stay indoors. I don't even go out, so I'm safe. So let's bust this myth.
This is even, this is one of the commonest questions. You shoot the question at them that don't step out.
Mhm.
And the answer would come that I anyways don't go out.
Yeah.
What you need to understand is that it's actually worse indoors.
Yeah.
Our walls, our roofs will trap whatever air pollution is coming outside. See, we don't have oxygen plants at home.
Yeah.
The air that we breathe is all coming from outside. There's a gas called radon gas, which is released by the walls, by the roof, by the furniture, by whatever, inanimate objects that you have inside the house. And that radon gas is going to trap whatever air pollution is coming from outside. On top of that, cooking inside the house, agarbattis, dhoop battis, and mosquito coils, a lot of that adds to the indoor air pollution. So indoor air pollution is actually worse than outdoor air pollution. And if you think that you are safe inside the house, very sorry to burst your bubble. You are unsafe inside the house, outside the house. The air pollution is a big menace, whether you are inside or outside the house. You're not getting spared if you think you're sitting inside and you're not stepping out anywhere.
Right. So you actually mentioned about incense sticks and mosquito coils, air fresheners, and I'm, culturally sensitive people are there.
Yeah.
But I want you to ask, what are the health risks with these? Can you
One,
just
yeah, one
elaborate?
coil of the kachua chap that used to be there is equivalent to a packet of cigarettes. One dhoop batti, the dhoop stick, the black dhoop stick that you have is equivalent to almost 2 packets of cigarette. One agarbatti would emit as much smoke as is from a single cigarette. And this is all proven data. This is not something which is made up. This is there in science. This is there in literature. There is very good Indian data. The Chest Research Foundation from Pune has done indigenous research on dhoop, agarbattis, havan that we do. And all of them contribute to air pollution. So a simple thing that I tell my patients is, God is going to listen to you irrespective of whether or not you're going to light an incense stick. So simple offering would be a diya, which does not cause a lot of pollution. And I understand it is culturally sensitive. A lot of our elderly, people at home, our parents would want to continue with that. But my advice would be, at least during these 3-4 months, don't do it. It
Careful.
adds,
Be careful with the use.
Yeah.
So also another point which struck here we talked about is our indoor plants. So are we really doing a lot with the indoor plants that we're growing, and is it taking care of our lungs?
No, there is absolutely no data to show that indoor air plants can actually help you with air pollution. They don't help you with air pollution. You can sit inside a room full of potted plants. Nothing is going to happen, So this is a common myth. You might develop allergies, pollen allergy. You can develop dengue if there is larva in the plants. So no, there is no data. There is absolutely no data to show that a snake plant or a money plant or some kind of a Chinese feng shui plant is going to increase the ambient oxygen levels or decrease the air pollution inside the home. So it's a myth. No point doing it.
Okay. So yeah, you really touched upon some scary, effects or advice that we kind of patients don't listen to us or parents talk about it. So now, when a patient comes to you, walking breathless to your outpatient department, or you see them in your office, how do you clinically differentiate between infection versus the symptoms because of air pollution?
So again, because as we started this conversation, we said that everyone is getting up with a scratchy throat these days, headache,
Yes.
running nose. So all this can be seen with a viral infection as well. What happens with infections is usually there would be fever, there would be cough. However, there's an overlap between the symptoms that are caused due to pollution and viral infections. The message here is that please do not go on popping pills. Do not take antibiotics yourselves thinking that these are infections. Unfortunately, most of the antibiotics are so rampantly available.
Yeah, agree.
And by the time, even for pollution related effects, the patients come to us, they've had a 5-day course of azithromycin or things like, other antibiotics, which is not true. Clinically, it is sometimes difficult to distinguish between the two, but usually the absence of fever and the other classical symptoms of an acute febrile illness would make us differentiate between the two. What we are having these days is a lot of exacerbations due to pollution and not due to infections.
Okay, so yeah, that's very well said. I mean, we need to be careful about what we are treating ourselves with. So now there is another big concern about pollution affecting pregnant women and their fetus. So your take on this?
Convincing data. It affects both maternal health and the fetal health. It has been shown that pregnant women who are exposed to pollution are more prone to developing things like eclampsia, high blood pressure during the last trimester. In these ladies, gestational diabetes is more common, premature labor is more common. If they have an underlying respiratory disorder such as asthma or bronchitis, that would get worsened or precipitated because of the air pollution. And then this also has bad effects on the developing fetus. These children have been shown, when they're born with low birth weights, IUGR babies, and growth retardation is very commonly seen in these patients. There is now data coming up that a lot of these patients might actually go on to they become respiratory cripples when they grow up. Very impressive data from US, which is known as the Tucson study, where it has been shown that children who were born when the mothers were smoking or when they were exposed to a lot of ambient air pollution, their chances of having obstructive lung diseases when they grow up are much higher than what the general population would have. So it affects both the mother and the unborn child, and that's a big, huge cause of concern.
Yeah. So literally, it's like having a smoking mother deliver a child.
Absolutely.
In this ambient air that we
Absolutely.
have.
Sure.
So when patients come to you to treat with pollution related respiratory symptoms, what misconceptions do they carry, and
The
how do you
big
clarify
Yeah,
that?
so the biggest is that staying inside
Mhm.
is not going to is going to be absolutely protective. A lot of people would say that we've stopped doing our morning walks, we only go out when it is afternoon. Today afternoon I was showing one of the patients the AQI. Today afternoon it was around 700. So I said it doesn't matter whether it is morning or afternoon, the air is going to be bad.
Yeah.
The other problem is that you usually advise patients to wear a mask when they're going outside, and if someone wants to do activity or exercise, if they're wearing a mask, that's not really advisable. So it's a very catch-22 kind of a situation. You want the patients to exercise, but at the same time, you want the patients to stay inside. So difficult handling these patients. But what we have seen last couple of years, people are becoming more conscious. What I want from people is to start asking questions now.
Yeah.
We are beyond that stage of becoming conscious. We now need to start asking questions as to what steps are being taken, because breathing is my birthright. This is I'm not asking for any luxury. I'm not asking for anything extra. If I can't breathe, then what else is there in life? Yeah.
So you've so rightly mentioned, touching the points that we need to go outdoors, we need to go jogging, we need to go cycling, but are we really advising our patients right when we are asking them to do physical exercise? So you've answered that. And moving on, um, most people relate, bad air quality to lungs only, but are other systems like the cardiovascular system affected as well regarding relating to, blood pressure
Sure.
and things like
Every
that?
system of the body is affected, whether it is the cardiovascular system or your gastrointestinal system or your lungs. Every system is going to your reproductive health. Everything is affected by pollution. The toxins that go inside via your lungs are going to be circulated through your blood circulation to every part of your body. And whether it is your heart, your pancreas, your reproductive organs, your brain, your eyes, every organ is going to have negative effects due to the pollution. So it's not just the lungs. The lungs are at the forefront, and that is why you notice them. They are brought to light. But every organ system, there are reports with cancers, there are reports with infertility, there are reports with high blood pressure, reports with stroke. So you name the disease and you have a causal association with air pollution. So it's not just the lungs.
Yeah, so there are other health related
Yeah.
issues that we see in normal healthy adults, be it a normal healthy adult or a child, that we see a lot of health issues because of air pollution. Now, coming to more specific things like the mask that we tell our patients or they themselves wear it, what advice or what suggestions about good masking do you like
Sure.
to
So it has to be an N95 mask. Anything less than an N95 mask in this pollution, the kind of pollution that we have now, should not be worn. If you don't have an N95 mask, then any mask would do. At least wear a mask. Even if there's no mask, you can wear a dupatta, you can tie a cloth, you can wear a surgical mask, whatever is available. But the preferred mask would be an N95 mask. And thankfully, N95 masks, during COVID, they were difficult to get by. They were expensive. Now, because there is a mass production of N95 masks, you would get them very easily. You don't have to even go to the chemist now. They're available at your general grocery stores, your Blinkit, and everyone is able to deliver these things at home. So my advice always very strictly is that if you need to protect yourselves from pollution, you need to wear an N95 mask. During COVID, the issue was that the mask was getting infected and you really needed to change those masks very frequently. And people perceived that these masks were expensive. With pollution, you don't need to really change that mask, the mask so very often. So it's not expensive. So if you can wear a normal surgical mask, you can wear an N95 mask. So my advice would be please wear an N95 mask.
And the next catching question is about air purifiers. So, do you really think they are the solvers? Are they medically speaking?
They're not the solvers, but they do help. And there is now more convincing data which is coming with air purifiers. It would actually depend on what kind of pollution you're exposed to. Now, if you are in an area like Delhi NCR where the pollution is largely due to the PM 2.5 with large particles, air purifiers are they're very, very helpful. And, there is no trial which tells you that if you jump out of an airplane without wearing a parachute, you'll not die.
Yeah.
So you can't do a trial like that. So it's very intuitive that if there is air pollution and if you're using an air purifier, it is going to be helpful.
Yeah.
The biggest myth that we have with air purifiers is, which I find actually very hilarious. People would come and say that when you advise them air purifiers, abhi air purifier laga liya, when I go out, saaf hawa ki aadat lag jayegi, I'll get used to clean air. And nothing could be sad. It could be sadder than this, when a patient or when anyone conversing with someone and they say that you'll be getting used to clean air. Come on, clean air is our birthright. You cannot get used to clean air. That's not valid.
Yeah.
Air purifiers help.
Well,
Buy them, use them.
rather than investing on air purifiers, we need to invest on the air outside. Find ways.
Yeah, I
Ask
wish we could do that.
questions, as you said. So now, as we all know, coming to the most important, we can't be packaging ourselves and go to the Himalayas for clean air. So realistically, what can we do for ourselves?
Wow.
So
two answers to that. The most important part that I always tell everyone now in the OPD is ask questions. Everyone is so active on social media these days. Everyone has Twitter, everyone has Facebook. Ask questions, ask our authorities as to what is being done. We are not asking for any luxuries, we are not asking for something too expensive. What are we asking for? Clean air. Come on. That's our right, we can ask for that. We are not doing anything wrong. The other thing is, because you cannot do anything at mass level, probably the simplest thing that you can do, which will help you, which will go in a long way, is wearing a mask. Take care of your overall general health, eat good food, get yourselves vaccinated so that the other respiratory comorbidities which are coexistent in this season, influenza, pneumonias, they don't affect you. And maintain a good, healthy lifestyle. Whatever medications you are on, whether they're respiratory medicines or they're cardiac medicines or whatever medicines that you are taking, please continue taking them. You don't want to fall ill during this season because, the added effect of pollution is going to make it worse. So try to stay healthy.
So, do you suggest, things like exercises, lung exercises? We have our pranayams and meditation, breathing exercises, which we.
An Indian pulmonologist is probably the only pulmonologist in the world who would be scared of prescribing respiratory exercises to a patient in this season. Dr. Panna, when you exercise, there is more amount of air which goes inside your lungs. With the air that is outside, the air that is surrounding us, I don't know how to ask my patients to exercise, because if they start exercising in this pollution, the more corpus of air that will go inside their lungs, it's going to be more harmful. So it's a very difficult question to answer. Yes, one needs to exercise, but difficult.
So that has really been a very refreshing conversation, and ironically about polluted air. So thank you, Dr. Arjun, for breaking up things so simplistically and telling us how we could take extra care of our lung health. And with this, to our listeners, stay healthy, stay safe, and we'll join again for our next conversation. Thank
Thank
you.
you.